Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Helping Older Parents video podcast, where I cover the best ways to support aging parents and other older loved ones so they can live better lives in their later years. I also often address common caregiving concerns and dilemmas, like what to do if you're worried about an older person's memory or safety, how to deal with Alzheimer's and other forms of dementia, and how to help your older loved one get the care they need. In today's episode, I'm going to explain something I wish all older adults and their families knew more about, which is what a doctor should check for if an older person develops memory loss or thinking problems or other signs of cognitive impairment. Because yes, if you have noticed memory loss or thinking problems in an older person, that is not normal, even if they're in their 80s and 90s. And that really should be evaluated by a health professional. And in fact, the initial medical evaluation can be done by a primary care office. You just need to know what to ask for. Now, you may be wondering, do these memory changes warrant going to the doctor, especially if it feels like it'll be a hassle to get the older person there? And I get that people often wonder that because there are two common myths about memory problems and aging that are pervasive not only among the general public, but even among doctors. And they are these. The first is that memory loss or thinking problems are normal aging. And the other is that there's nothing to do because memory loss can't be cured or reversed. Some people also think that there's nothing to do because if it's Alzheimer's or another form of dementia, that is not curable. The thing is, both these beliefs are false. And so it's really a shame that even many practicing doctors believe these myths. What this means is that even if memory or thinking problems are brought to the attention of some health professionals, people are sometimes told that it's either normal aging or that there's nothing to do. But again, this is wrong. Memory loss and thinking problems are indeed common as people get older, but they're not normal. They are the sign of a health problem affecting the brain. And although it's true that some older adults are experiencing symptoms of a non-curable condition, such as Alzheimer's, there are many other health problems that can affect brain function, and some can be treated. So in the rest of this video, I'm going to do two things. First, I'm going to take you through the 10 most common causes of cognitive impairment, of memory loss and thinking problems in older adults, so that you understand what might be causing an aging brain to malfunction. And then I'm going to take you through 10 things that doctors should do to evaluate an older adult, such as your aging parent, if they are experiencing cognitive symptoms. That way, once you get to the doctor, you'll know what to expect and you'll know what to ask about. And if you want more details about this, you don't need to take notes like crazy during this episode, because I do have an article on betterhealthwhileaging.net that lists all these things in detail. And this is also covered in my book, When Your Aging Parent Needs Help, a Geriatrician's Step-by-Step Guide to Memory Loss, Resistance, Safety Worries, and more. So we're going to get started, but before I get into these common causes of memory loss and thinking problems in aging parents, I have a very quick request for you, which is if you are here and you find this topic interesting or you're finding my video podcast interesting, if you haven't yet subscribed to my Helping Older Parents channel, could you please go ahead and do so? It would mean a lot to me. It does help me out. It helps other people find the channel when you subscribe, and it does help support the work that I'm doing. So moving on, we're going to cover the causes. And before I start listing them all for you, there's something really important that I want you to keep in mind, which is that cognitive impairment, similar to many problems that affect older adults, is very often multifactorial. That means that there is usually going to be more than one cause of the problem that your older loved one is experiencing with memory, thinking, or brain function. So as we go through this list of common causes, just keep that in mind. And let me now take you through my top 10 causes. So number one, and something that geriatricians are always checking for, is medication side effects. Many commonly used medications interfere with brain function, and sometimes when we identify and help an older person reduce or ideally stop those medications, their memory and thinking can get significantly better. And what you need to know is that some of these medications are available over the counter, such as things like Benadryl and similar sedating antihistamines can make people more confused than they otherwise would be or can affect their memory. Other types of medications we're usually checking for include sedatives, tranquilizers, and anticholinergics. And if you want to know more about those medications, I have articles on Better Health While Aging that list them in more detail. Number 2 common cause is what we call in medicine metabolic imbalances. So this means abnormal levels of some substance in the blood chemistry. The most common ones are blood sodium being too high or too low, blood calcium being too high, or blood glucose being too high or too low. There are some other substances in the blood that also can cause the brain to malfunction if they get to be too high or too low. Kidney or liver dysfunction can also cause metabolic imbalances that can affect memory and thinking and cause cognitive impairment. Number 3 on my list is problems with hormones. So especially in older adults, we want to check for thyroid hormone being too low or too high. It's also possible that imbalances in estrogen and other sex hormones can also affect brain function, but it's less common for us in geriatrics to be checking for those. Number 4 on my list is vitamin deficiencies. So the one that we especially like to check for in geriatrics, if an older person is having difficulty with memory and thinking, is vitamin B12. It's very, very common for older adults to be low in that one. And if you want to learn more about that, I have a video on my sister channel, Better Health While Aging's main channel, that covers that in depth. We also want to consider low levels of other B vitamins or folates. And then people sometimes want to know, what about vitamin D? So this has been studied a lot. It's certainly possible that low levels, very low levels of vitamin D or other nutrients may affect brain functions. But ultimately, what we found is that supplementing people with vitamin D doesn't tend to help quite a lot. So I mostly focus on vitamin B12. Number 5 on my list of common causes is delirium. So delirium is basically a state of worse than usual mental function that is usually brought on by hospitalization, surgery, or a serious illness. So people sometimes refer to it as, hospital dementia. It's not actually a dementia, but what we do know is that when the body is sick, or if the brain is under a lot of stress, either physical stress due to an illness, or sometimes for some people, even just not sleeping enough and a very stressful situation can tip them into this. That's more common if they already have something like Alzheimer's. The brain can start kind of going haywire, and that is delirium. And people will start to act very confused or very spaced out or potentially hallucinate. So delirium can cause somebody who is usually normal to behave like somebody who is psychotic or has Alzheimer's or has another form of dementia. And in people who already have a diagnosis of Alzheimer's or dementia, or maybe they have a diagnosis of mild cognitive impairment, delirium can make them much worse than they usually are. Now, delirium is often reversible, but it can take days or even weeks, or in some older adults, I've seen them slowly improve over months and months and months. So that's something to keep in mind before we, give somebody a diagnosis of something permanent or longstanding, is could this be delirium that they are experiencing? Number 6 on my list is psychiatric illness. So most major psychiatric conditions can cause problems with memory, thinking, or concentration. And depression and anxiety are not uncommon in aging adults. There are also some older adults who have what we call sort of severe mental illnesses, such as bipolar disorder, schizophrenia, or other major mental illnesses. Number 7 on my list is substance abuse and or withdrawal. So there are lots of substances that can intoxicate someone and cause them to have difficulty with their memory and thinking. So for instance, alcohol can do this. Drugs can do this. Prescription medications, especially sedatives and some painkillers, can do this as well. Now, there are a couple of different ways that substances can affect brain function. So one is actual intoxication. Another one is damage from chronic overuse. And we see this especially with alcohol. If people have used alcohol for long enough, they can end up with permanent changes to their brain that can affect memory and thinking. And then brain function can also easily be impaired by withdrawal. So we want to be thinking, not only does this person, is this person possibly intoxicated, but is this somebody who usually drinks and for some reason, has stopped or has not been able to access their usual source of alcohol, because that too can cause changes in their brain function. Next on the list, number 8 is damage to brain cells due to injury. So there are a couple of different types of injuries that I think about. So one very common type is what we call vascular damage. So vascular means related to blood vessels. And damage to blood vessels throughout the body is very common in later life. Definitely affects blood vessels in the brain. And that can have implications for brain function and brain health. So some examples of blood vessel problems in the brain, first of all would be a major stroke, but also people can have very small blood vessels in the brain affected. That's sometimes called cerebral small vessel disease. It does show up on MRIs. So risk factors for any kind of blood vessel problem, whether it's affecting the brain, the blood vessels around the heart, or the blood vessels elsewhere in the body, the risk factors are things like having high blood pressure for a long time, having chronic inflammation, having your blood sugar be chronically kind of high, even a little bit high probably puts a little bit of stress on the blood vessels as well. And then there's another type of injury that people can experience, and those are head injuries. So it's important to know that a head injury can cause a temporary change in brain function and can even make people act kind of confused, or sometimes it can cause long-term impairments. So it depends a little bit on whether it's a more recent head injury or whether it's a severe head injury from a long time ago. And then we've also learned that people who've just had played sports or been in certain activities where they've had a lot of head shocks, such as, football, that can cause a certain form of chronic injury to brain cells as well. Number 9 on the list is damage due to brain cells due to what is called neurodegenerative disease. So rather than an actual injury, these are conditions, diseases really that develop within brain cells that slowly damage and kill the neurons over years. So some common ones that you've probably heard about. The best known one is probably Alzheimer's disease, but we also have Lewy body disease, there's Parkinson's disease, there's frontotemporal degeneration, and there are actually several other types as well. These are all fairly common causes of mild cognitive impairment and eventually dementia. And actually what we know is as people get older into their mid-80s and above, if they're having neurodegenerative diseases, they often have more than one, or their neurodegenerative disease might be combined with some vascular damage. Number 10 on my list is infections. So we see this a little bit less often, but it certainly does happen. So certain acute or chronic infections can affect brain cells directly. The causes might be viruses, they might be bacteria, occasionally parasites, occasionally fungus. Now, we also see people sort of getting like brain malfunction from having a severe illness outside the brain, right? Such as a very bad pneumonia or a very bad urinary tract infection. So if an infection outside the brain causes cognitive symptoms, that's delirium. Whereas we have other infections that directly affect brain cells, and we want to consider those as well. So that's my list of top 10 causes. I'm going to mention one more potential cause that people sometimes ask me about, which is toxins. So it's true that toxins are another potential cause of problems with brain function in aging. So for instance, heavy metals, air pollutants, water contaminants, pesticides. Now, toxins are not routinely checked for by geriatricians and probably not by most mainstream clinicians. I know that some naturopaths, some functional medicine doctors check quite a lot for toxins. So I think it's, something to consider, but not usually really on the radar of geriatricians. Similarly, because geriatricians care for people who are generally over age 65, if not much older, we're also not usually considering brain fog due to perimenopause or menopause or estrogen fluctuations, because normally the people we're working with are, well beyond that phase of life. So those were my top 10 causes of problems with memory and thinking. And so as you saw, there are many medical conditions that can affect brain function. So if you notice problems with memory and thinking in your aging parent or in another older loved one, or even in yourself, it's really important to get a medical evaluation so that these other causes can be checked for. So let's now talk about that. So what should doctors do? What should they check when an older person is brought in for memory or thinking problems? So here I'm going to take you through a list, which is based on my practice, my geriatrics training. It's the practice of most geriatricians, and it's basically in line with what expert guidelines recommend. So basically, health providers need to check for the common causes we just went through to try to rule them in or rule them out. And then if they're not sure about one or two of them, they could consider referring to a specialist for more evaluation for that cause. So Here are the things that I would say should be done. So number one is to ask about and document the older person's concerns about their memory and thinking. Now, this might require a tactful approach. Some older people are very defensive about anything going on with their memory or thinking, or maybe have already been getting into arguments with their adult children or family members about whether or not they're having a memory problem. If that's the situation in your family, you want to let the health provider know if it's been a touchy topic so that maybe they can be really discreet and tactful in how they ask the older person. But I do think it's important to try to find out, is the older person concerned about this? Are they aware of it? What have they noticed? And then next is that the health provider really should request information about signs of memory or thinking problems from other people. If they never ask a family member or try to get an outside perspective, honestly, I think they're doing it wrong, because we know that often older people who are having memory or thinking problems are not going to be accurate reporters of their own symptoms. They're either going to forget or they're going to be protecting themselves. So it's important that health providers talk to a spouse, an adult child, another informant, a paid caregiver, someone. And what you should know is that it's not a HIPAA violation for the doctor to get information from the family. It's not a HIPAA violation if you are family to talk to the doctor. That is because as lay people, you are not subject to HIPAA. HIPAA applies to professionals, covered entities, professionals and insurance plans, to make sure that they do not blab confidential information, unless the circumstances are correct. Okay, number 3, what should be done is it's really important to ask the older person and the informants whether the older person is having any difficulties in managing daily life tasks. So especially we want to ask about activities of daily living, ADLs, and we want to ask about instrumental activities of daily living, IADLs. So activities of daily living are the basic self-care skills that we generally learn in early childhood. They are things like getting dressed, grooming oneself, using the toilet and managing your continence, bathing, feeding oneself, walking. And then the instrumental activities of daily living are more cognitively sophisticated skills that we usually learn as teenagers so that we can live independently as adults. Things like managing finances, managing transportation, food shopping and meal preparation, managing your communications, phone, mail, email, texting, social media maybe, home maintenance, medications. So we want to ask the older person if they're getting assistance with anything, if there's anything they're struggling with, and we want to ask other people as well. So next on my list is that health providers should check for other signs of behavioral, mood, or thinking symptoms, things like hallucinations, delusions, personality changes, apathy, depression symptoms, anxiety, getting lost, visual spatial problems. So if you want to hear more about those symptoms, I have a list of 21 of them that I go through in a related video, and you can check that out. Number 5 is that the health provider should ask about any new symptoms or changes to physical health. They especially should check on whether there have been any neurological symptoms, such as new problems with walking, balance, speech, coordination. I might put like double vision in there as well. And then number 6 is they should ask about substance use and consider the possibility that the older person might be experiencing some substance abuse or some withdrawal from a substance. So we want to diplomatically check with the older person, and then we also want to consider, again, asking other people who might be more accurate reporters. Number 7 on the list is review all medications and focus on those that affect brain function. So especially sedatives and tranquilizers, anticholinergics. So those are the medications kind of like Benadryl. Those affect acetylcholine, a neurotransmitter that is very involved in brain function and also involved in other bodily functions. We want to check for antipsychotics, and we want to consider the possibility of pain medications as well. Number 8 on the list is perform a physical examination. Ideally, this health provider is going to lay hands on the older person. So the examination should include a basic neurological evaluation and watching how the person gets up and walk. We generally want to check for tremor, and stiffness, a resting tremor. So Parkinson's is a resting tremor. So that means the person should be sitting there, maybe with their arm on the table, and, is there some of this happening? A tremor when they're in motion is a different type of tremor, and from a neurological decline perspective, potentially less concerning. Other things that should be checked for on the physical exam will depend on the person's past medical history and their current symptoms. Number 9 is to assess the older person's orientation and perform a short office-based cognitive test. And what I do to normalize this is as I tell my older patients, if I'm doing this, that this is a little something that I do with all older adults. It's going to seem silly, and I thank them for indulging me. So orientation means, does the person know the day, the date, the month, the year, where they are, who they are? That would be assessing orientation. And then there are a couple different short office-based tests that we can do. The fastest one is it's called the mini cog. That is a 3-item recall and then drawing a clock. A little bit more detailed, but takes a little bit longer to administer, are tests such as the MoCA, Montreal Cognitive Assessment, or SLUMS, St. Louis University Mental Status Exam. These take about 15 minutes, sometimes more if a person's very confused. And then people sometimes ask me about the mini mental state exam, MMSC. That is an older option that was used quite a lot, I would say 20, 30 years ago. Used less often right now, partly because the author decided to enforce their copyright and wants people to pay to use it, where some of the others are free. MoCA, SLUMS, and mini mental are all scored out of 30. And then number 10 on the list of what health providers should do is they should order laboratory testing and consider brain imaging. So generally the blood tests that they're going to be, that makes sense to consider would be what's called a complete metabolic panel, which includes electrolytes, liver function, kidney function, vitamin B12, thyroid tests. And then a brain CT or MRI is often a good idea unless they have had one recently. Definitely a good idea if there's been any recent head injury. And also good, you can't actually diagnose a neurodegenerative condition just with a MRI or brain CT, but it can be useful, and very occasionally something surprising shows up in there. So let me now tell you kind of overall the 4 key things that I believe should be happening during these evaluations. So basically, there should be documentation of the patient's concerns and the family's cognitive concerns. There should be documentation of any difficulties with daily life that the person is experiencing or that are being observed. There should be some kind of objective assessment of the patient's memory and thinking abilities. It's one thing for, an older person to say, I feel like my memory is getting bad, or for their family to say, they keep repeating questions or having difficulty with this. That's helpful, but also the short office-based tests give us a little objective snapshot in the moment that we can later refer to. And then we want to evaluate for, again, common medical causes and contributors to cognitive impairments. So where can you get this evaluation? Well, I would say this can be done in primary care and should be started in primary care. We do not have enough geriatricians and neurologists to evaluate every single older person who is having some challenges with their memory or thinking. And it is appropriate for a primary care office to start off with those checks for, medical conditions like metabolic imbalances. They can certainly check medications and take a few other steps. Now, this might take at least 2 visits, especially if the provider decides to do one of those office-based cognitive tests, such as the MoCA or the SLUMS. So it might take 2 visits, but it can be done in primary care. So if you're somebody who has gotten concerned about the memory and thinking of your aging parent or another older loved one, now you know what are the possible causes, and now you know should be done as part of the evaluation. If you want more details, please be sure to check out my related article. You can even print it out and use it as a resource. So I hope this has been helpful to you. If you did find this helpful, please subscribe to my Helping Older Parents channel, because I will be posting more videos related to memory loss and other age-related health challenges and how to care for somebody who is experiencing those challenges. So with that, thank you very much. Thank you so much for watching, and I look forward to seeing you again soon on an upcoming episode of the Helping Older Parents video podcast.